Okay, my name is Michelle Demeline, and I'm going to be talking about the American Diabetes Association. And this is my audience. Okay, diabetes. It's something we hear about all the time, but it's also one of the most misunderstood diseases. The American Diabetes Association is a nonprofit organization whose mission is to prevent and cure diabetes and to improve the lives of people that are affected by the disease. Imagine you're 10 years old and your dad has this medical condition named diabetes. You're not really sure what it is, and your dad could never fully explain it to you because he didn't know much about it himself, much less how to take care of it. Years go by and suddenly the doctor tells you that your dad has to have his leg amputated from the knee down because he never took care of his diabetes. Your family's world is turned upside down as your dad is delivered the news that he'll be handicapped for the rest of his life because he didn't have enough information about his condition to know how to prevent this. Today I will tell you why it is so important for people to educate themselves on diabetes. I'll discuss the prevalence of diabetes and what can happen if it goes uncontrolled. Most importantly, I will tell you about the American Diabetes Association and how donating to their foundation can help save the lives of those who don't have adequate information about this disease and suffer as a result. You may be wondering what sparked the creation of the American Diabetes Association. Diabetes mellitus is a complex disease that requires significant changes in lifestyle upon diagnosis. Diabetes causes more deaths a year than breast cancer and AIDS combined. According to Biomed Central, more than one-fourth of the estimated 26 million Americans with diabetes remain undiagnosed, and more than 90% of the estimated 79 million adults with prediabetes remain undetected. These are the people that will end up in hospitals as a result of diabetic complications they never knew they would have. The Pakistan Journal of Medical Sciences came out with a study that states diabetes has caused 4.6 million deaths worldwide in the year 2011, and the global figure of people with diabetes is anticipated to rise from 366 million in 2011 to 552 million by the year 2030. I recently had a clinical rotation in a medical surgical unit, and about 85% of the patients I saw had some sort of complication from diabetes, and it ranged from needing insulin 4 times a day to having ulcers that needed new dressings constantly to limb amputations from the diabetic neuropathy leading to unchecked wounds and gangrene. So what can be done about the increasing number of people unknowingly getting diabetes, and how can we help them? In 1940, the American Diabetes Association was founded by 28 physicians whose mission it was to prevent and cure diabetes and to improve the lives of all people affected by the disease. In 1949, when Dr. Levine discovered that insulin transported glucose into cells, the ADA began production of a standardized insulin syringe to administer the medication. That next year, the American Diabetes Association created a meal planner that divided foods into 6 groups, or exchanges, based on the calories, carbohydrates, protein, and fat in each serving of food. And you can find more information about that in their official website, which is diabetes.org. Over the next 50 years, more and more information about diabetes was being discovered. There were new ways of testing urine glucose coming out, oral medications called sulfonylureas, which stimulated the pancreas to release more insulin, and more. With the help of the American Diabetes Association, more and more of these discoveries are being made about diabetes every year. Now, what does the ADA actually do, and how can you contribute? According to the International Journal of Healthcare Medicine, controlling the incidence of diabetes and treating the disease successfully depends on a combination of disease management and healthcare promotion strategies. Certain communities of people are more at risk of diabetes than others, such as African Americans, Asian Americans, and older adults in general. The American Diabetes Association creates programs like Project Power to reach out to these specific communities to help raise awareness and prevent diabetes. Project Power is a faith-based program targeting the African American community and includes 6 workshops that teach all about diabetes and how to be healthy to create the best life for yourself. In addition to the awareness programs and prevention programs, the ADA allows people in the community to volunteer as educators to donate their time to the community and the cause. These are the people you will see planning and running organizations' events, and you can be one of them if you volunteer. Even if you have a really busy schedule like mine and have a hard time scheduling time to volunteer, there are ways you can help right now, such as donating to the organization over telephone or online. In conclusion, Diabetes is a disease that all people around us knowingly and unknowingly live with. I encourage all of you to educate yourself about diabetes, whether you have it or not, and spread the word about the American Diabetes Association. Together, like the ADA's mission says, we can work towards preventing and curing diabetes, and we can help improve the lives of those who are living with it. Help make diabetes a talked about and known disease so others can have better lives. Thank you.